Defibrillator is a machine used to deliver shock during a CPR to a victim who has got a shockable rhythm.
A defibrillator has the following components: the main machine, the detachable hand paddles which are fitted in the machine. Remember, provide CPR while defibrillator is getting ready to deliver a shock. Turn on the machine. Set the machine on asynchronized mode. Attach the chest leads of the defibrillator to the victim's chest so that you can see the ECG on the monitor. Select the amount of joules to be delivered.
The upper limit of joules to be delivered is still not determined. In children, start with 2 joules per kilo for the first shock, and for subsequent shocks use 4 joule per kg.
Remove the pads from the machine and hold them in your hands. Press the charge button to get the machine ready to deliver the shock. Apply gel on each of the blades. Keep one blade on the right upper chest just below the collarbone. Place the other blade on the left side of the chest just below the nipple. Make sure to keep a distance of more than 3 centimeters between the blades. Make sure everybody is clear by saying, "I clear, you clear, all clear." Remember to keep the oxygen away, and nobody should be in contact with the patient while delivering the shock. Press the delivery button. You will visualize sudden movement of the victim's body as a result of muscular contraction on delivering the shock.
After delivering a shock, do not try to analyze the rhythm. Start the CPR immediately with the chest compressions. After completing 5 cycles of chest compression and the rescue breaths, when you are switching between the rescuer 1 and rescuer 2, that is the time you can use to analyze the rhythm.
Now, let us see how an automated external defibrillator works. The advantage of an AED is that you don't have to worry about recognizing a shockable rhythm. All you have to do is just start the machine, attach the pads, and stay clear of the victim so that the machine analyzes the rhythm and assesses whether patient needs a shock or not. After few seconds, the machine will reveal whether the rhythm needs a shock or not. If the rhythm needs a shock, then you will be required to press the shock button and the shock will be delivered. Let us now summarize the steps to operate an AED. Turn on the AED. To do this, you have to open the carrying case. Then you need to carefully listen and follow the AED instruction. AED will instruct you to apply the pads on the patient's bare chest at specified position. Some AEDs may have adult and pediatric pads. Adult pads should be used for those who are 8 years or older. Now, on the victim's bare chest, attach the adhesive pads. Attach one pad on the side of the left nipple. Place the other pad on the victim's upper right chest below the collarbone. Now, AED will analyze the rhythm and assess whether the rhythm requires shock or not. Ideally, you will pause during or immediately after giving set of compression and should make sure that no one is touching the victim, not even the person who is giving breaths. AED takes about 5 to 15 seconds to analyze the rhythm. Some AEDs do it automatically, while some will tell you to push a button to let the AED analyze the rhythm. After analyzing the rhythm, the AED tells you if shock is needed. If AED recommends a shock, it will ask you to push the shock button after clearing away from the victim. You must make sure that no one is touching the victim so as to avoid injuries to the rescuer. After ensuring that, one can make a statement loud, such as, "All clear, everybody is clear." Make sure no one is in contact with the victim and perform a visual check. To deliver the shock, press the shock button. This will produce sudden contraction of the victim's muscles. Immediately after the AED delivers shock, resume CPR starting with chest compressions. You should not remove the AED or turn it off. The AED would analyze the rhythm every 2 minutes. If no shock is advised by the AED, resume chest compressions. You do not need to perform the pulse check again. You need to consider some special situations while using an AED, such as hair on the chest of the victim, water or sweat on chest of the victim, a victim lying in water or a small puddle, a victim lying in snow, a victim with an implanted pacemaker. When the victim has hair on his chest, the hair may prevent pads from sticking. The AED may tell you to check pads, and if this happens, press the pads down more firmly. If they are still not sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of pads to the bare skin. If your AED supply kit has a razor, use it to shave the area, then reapply a new set of pads. Water on a victim's chest could allow shock to pass through the water between the pads and prevent delivery of the effective shock dose to the victim's heart. If you see a victim lying in water, you should quickly move him to a dry area. If chest is covered with water or sweat, wipe the chest quickly as it does not have to be completely dry. Sometimes, in the area where the AED pads are to be applied, you might find an implanted pacemaker. This device will look like a round or a square lump, smaller than a deck of cards. If you see this lump, try to avoid putting pads directly over the lump. Do not place the pad directly over a medicine patch. If the shock delivery will not be delayed, take the patch off and quickly wipe the chest before you put on the pad. There are some differences in use of AED for infants and children under 8 years of age. Some AEDs have been modified to deliver different shock doses for adults and children under 8 years of age, thus allowing you to deliver the child appropriate shock of 50 to 75 joules by a pediatric dose attenuator. The most important thing while using an AED is to be familiar with the device before you actually start using it. When you are using an AED, first turn it on and then follow the prompting, as it will help you to go through the rest of the steps. For defibrillation in infants, that is children less than 1 year of age, manual defibrillation is preferred to an AED. In case of non-availability of manual defibrillation, AED equipped with pediatric dose attenuator is preferred. If both the things are not available, one can use an AED without a pediatric dose attenuator.